from AlluraFX. For all the value that for all the value that these monitors, remote monitors provide, they're going to cost money. So the question is, do we have enough data for the hospitals and clinics to evaluate, to make a business case to provide these devices to the patient? And specifically, do we see any issues with reimbursement? Thanks.
Dr. Grasso, would you like to take that?
Sure. There are certain disease states like congestive heart failure or COPD that a lot of the patients oscillate back and forth from their homes to the hospital. And if you look at all the costs associated with that, ambulance transports, costs of the emergency room for assessing that patient, if you add up all those costs, direct and indirect costs, it's quite sizable. And over the past 3 years, the cost of monitoring equipment has gone down substantially, just like most electronic hardware that's available. So we're seeing that the cost of inserting the technology in the home certainly is nowhere near the same, even for the monthly package and cost of them oscillating back and forth to the hospital. And additionally, if they come back to the hospital within 30 days, now there's all sorts of disincentives for patients bouncing back and forth in 30 days. There's fines and no reimbursements. So that scale is certainly tipping in the opposite direction.
We have another.
This is for Mr. Goldberg of Ideal Life. I'm with the University of California Irvine School of Medicine, and I was just curious if you could describe the device that you mentioned for the wounded soldier rehabilitation and their mental health engagement. What kind of things are you recording with the device, or what does the device do?
Very simple. It's two critical components for us always was the biometric reading information and the subjective information through our messaging engine on the actual device. And it's really amazing what you can do with a few simple technologies and in a very innovative way. So it's a simple accelerometer that allows us, most importantly in that type of scenario, the individual could have a scale in the home so we can remotely monitor weight fluctuations, ensuring that they do have some level of activity. And using the accelerometer layered on top of the weight readings, really evaluate that activity threshold. But why I mentioned that particular case as an exciting program is because more important than the biometric information was really the impact of the messaging engine to allow the mental health program to really take shape for a longer period of time. Oftentimes in cases like this, people come to clinics or rehab centers, maybe are interacting with phone calls, but oftentimes you have certain cases where they're quite resistant to those programs, and they can't happen for very often. So cell phone applications and programs like this could be quite effective in that case.
Next question is in the back right of the room, the young woman there. Thank you.
Hi, my name is Maria France with the StratiMed Group, and we give tablet PCs to patients when they come into the doctor's office and they use it in the clinical setting. And what we found is it's not the young people or the older people. They're thinking about their health all the time. It's actually the middle-aged group, the 40s and 50s, who use computers every day. They don't think about their diabetes and their hypertension now. It's like a problem later. So I was curious, in terms of patient incentive programs, ways to get them to think about it when they're in that perfect preventative state, before they're expensive, before they have very complicated things. What have you thought about or experienced?
I assume that's directed to me. Some of the things that we're starting to see now is, if you want to call it private reform, we're seeing a lot of employer-based programs, which formerly simply were wellness programs, encouraging people to stay active. Now they're actually really incentivizing groups, and now some of the health plans are starting to do that with incentivizing with co-pays and deductions in that, and trying to incentivize that demographic, because you're right. People often think, all of us are the same, where we think of problems that might happen later. I don't want to deal with it now. Think about it now. But now we're starting to see some of these incentives take shape and really encourage that to be more proactive and preventative.
Gentleman in the back of the room standing up, please. You have a question?
Yes, I'd like to, especially to the heart monitoring fellow in the end, find out two questions. Number one, who has access to all the data that's generated on a patient's heart activities that are generated by your system?
The doctor has.
Don't you?
Does the
Not
insurer,
on
do the
purpose.
insurers, is there a database that the insurers can access?
There's not currently a database for the insurance companies. The doctor has access to 100% of that data, as well as all of the summarized information. And then that information is passed along with the invoice or the reimbursement request from the insurance company. It's certainly available to them should we enter into a partnership to make it better for the consumer or for the patient.
Okay. Do we have time for
Okay.
another question, Jill?
One more quick question.
Okay.
Anyone? Anyone?
Question for anybody in the panel. What's the outlook for a CMS approval of remote patient monitoring?
Anyone?
I can take 5 seconds on that. The interesting play that's happening right now through the accountable care organizations, really blowing out the concept of medical home, that is indirectly impacting reimbursement, if you want to think about it like that. Most importantly, though, I'd always mention that we can't wait for reimbursement to happen. As long as we have affordable enough tools, we're finding, at least in our case, that there are enough business cases and proven ROI activities that validate the use cases of our system. But definitely some of the concepts and legislation that just happened with health reform is incentivizing through accountable care organization concept.
Thanks, everyone. It's a great
Thank
panel.
you very
Thank you all for your
much. Give
contributions.
them a round of applause.